Psoriasis is a condition where the immune system overreacts and causes inflammation, resulting in red, thick, itchy patches of skin with silver-colored scales. It can also lead to cracked skin and swollen joints. While there is no cure for psoriasis, there are treatments that can help reduce symptoms and even achieve clear skin or remission. In the past, older medications used to treat psoriasis were quite toxic, so the goal was to control the disease and reduce medication doses to minimize side effects. However, complete clearing of the skin was difficult due to the serious side effects caused by high doses of these drugs. Fortunately, newer medications are much safer and complete clearing of the skin is now more achievable. Doctors often recommend staying on the medication even after the psoriasis clears to prevent symptoms from coming back. However, it's important to note that just because the symptoms don't return, it doesn't necessarily mean that the disease is in remission. When we talk about remission in psoriasis, there's no one-size-fits-all definition. It's often used when almost all lesions have disappeared from your skin, but the more accurate term for that state is nearly clear. Being completely clear means you don't have any psoriasis lesions at all. Doctors use the Psoriasis Area and Severity Index (PASI) score to evaluate the color, thickness, and scaling of psoriasis, and a 100% reduction in lesions indicates that you're clear. However, even having 0 lesions doesn't necessarily mean your psoriasis is in remission. True remission means that your skin is completely clear and you're no longer taking medication to control the disease. Interestingly, the terms completely clear and remission are often used interchangeably, but research has shown that almost 80% of people with psoriasis who believe they are in remission are still receiving treatment. The average remission period lasted 31 months for this group. New medications for psoriasis are very effective, leading to the question of whether some patients who are clear while on treatment might be in remission and able to stay clear when they're off treatment. With some treatments, you just need a dose of medication every few months to keep your psoriasis under control. It's also important to note that current medications are very safe, so there's no need to stop taking them once your symptoms clear. The immune system is quite complex, making it difficult to predict who will experience long-term remission from psoriasis. Psoriasis is often caused by an overproduction of signaling molecules that lead to inflammation and other symptoms. Even if medication clears the symptoms, stopping the medication may not change the underlying genetic predisposition to the disease. Those with guttate psoriasis, which causes sudden breakouts of small plaques on the arms, legs, and torso, tend to experience long-term remission once their symptoms are cleared by medication. Most people with psoriasis will have periods of clear skin alternating with flare-ups, but the duration of remission periods is not well documented. According to the American Academy of Dermatology Association, most periods of remission last between 1 and 12 months. Research also shows that many individuals who achieve remission from psoriasis end up needing medication again, with more than 41% restarting medication after a year and 86% after 5 years. To help make remission periods last longer, here are some steps you can take. Avoid injuries to the skin, as psoriasis plaques tend to appear in these areas. Keep your skin moisturized to prevent dryness, cracking, and bleeding. Spend time outside to benefit from the calming effects of the sun on your skin's immune system. Eat healthy foods and consider a gluten-free diet, as obesity and inflammation are linked to psoriasis. Limit alcohol consumption, as it may exacerbate psoriasis symptoms. Continuing to take your medication even after your skin clears can also help keep your psoriasis under control and prolong remission periods. Working with your dermatologist to develop a treatment plan tailored to your specific needs is crucial for managing your symptoms and achieving remission.